Hi, thanks for joining us on Resilience Radio, where we explore the art and science of thriving in a turbulent world. I'm your host, Dr. Linda Hoops. If you're listening to this show live and have a question or comment, we'd love to have you call in at 347-826-7314. That's 347-826-7314. You can find additional episodes on the web at blogtalkradio.com/resilience-radio.
Good afternoon. Thanks for tuning in to today's session of Resilience Radio. I talk about the art and science of thriving in a turbulent world, and today we're going to talk about the science part. One of the things I've been interested in lately is how important energy is to resilience, particularly physical energy, but that in turn is connected with emotional, mental, and spiritual energy. Today's guest, Dr. Juliet Mavromatis, is a primary care physician who I've known for a number of years. And one of the things I've been very impressed with about her over all this time is her goal of staying current on medical research and how she applies it in her practice. And so today we're going to talk a little bit about physical energy and resilience and how we can help sustain our resilience through sustaining our physical health. Welcome, Dr. Mavromatis.
Thank you, Linda. It's great to be on the show.
Good. So let's start back at the beginning. I'm curious to hear a little bit more about you and your practice and what got you into practicing medicine.
Well, so I started practicing, I think, in 1997, and I guess I went into medicine. I actually made the decision to be a doctor when I was 18, which is a bit unusual, but I was interested in biology, and I'd had a series of, I actually had bad allergies and asthma as a kid and had to go to the doctor a lot, had to be in the hospital, was in the emergency room, had an allergist and a pediatrician and who I related to, and then I became interested in biology and did some bench research in high school and decided that I didn't want to do research, that I wanted to interact with people, so apply that biology to people and practice medicine. And both my parents are in sort of social sciences, so that influenced me too. So I applied to the University of Michigan, had a combined undergraduate and medical school program that was 7 years at the time, and I applied at age, when I was 18 and actually got in and, have not ever regretted the decision of being a doctor since then. So that's kind of
That's great.
I got here.
So,
yeah.
Mm-hmm. So it sounds like you like the scientific side and also just the interpersonal working with your patients side of things too.
Yeah, I mean, I really like to know. I mean, I love the science. I love reading about medicine. I read medical studies and journals as much as I'm able as it relates to my field. But I, feel that it's really important to get to know people well because, after all, you have to talk to people about health, and you're seeing them for a 30-minute period, and which is a tiny little window in their life. So you have to figure out how to integrate medical knowledge and treatment into a patient's life, and so it's really important to be able to understand your patients as people. So I like to get to know people well and understand sort of their psychological and their cultural background, that kind of thing.
Mm-hmm. That makes sense. So when I think about the relationship of resilience to medicine, I actually think of a couple of connections. One of them is that I think that medical issues or health issues are some of the things that can strain people, can stress them, and are things that they are required to respond to, hopefully with resilience. But I also think that the physical well-being that we have is an ingredient in the resilience that we use when we face other kinds of challenges, whether it's relationship issues or job stressors or whatever. Mm-hmm. Can you tell me a little bit about how you think about resilience as it relates to what you do?
Well, yeah. So I mean, I think being so there are two parts. I think of when I think of resilience, I think of having sort of a reserve of energy, and I think that there are physical dimensions to that, and then there are certainly emotional dimensions to that. And I think that I think that people can build their physical energy and their physical health by, engaging in sort of healthy lifestyle practices, and there are things they can do to promote that. And then there are things that people should be doing also to promote their emotional health, and both of those are very, tightly connected. But and then there are things that certainly drain physical energy that people should be aware of, and try to, being conscious of those things enables people to sort of protect their physical energy. So in terms of physical health, I talked about maintaining like healthy lifestyle practices, and there is some judgment call on this, but we do know that certain things are good for your health, like for example, exercising, and it makes people feel better emotionally, psychologically, but also helps prevent disease, and so it helps reduce risk of cardiovascular disease and cancer, and there have been linkages with reduced risk of Alzheimer's disease in people who are physically active. So it's clear that if engaging in exercise can really help promote physical health and increase energy. So and it's recommended that people, I can tell you what the guidelines are specifically. People exercise 30 minutes 5 days a week moderately. And if you can't do that, then, you can also exercise vigorously for 75 minutes a week, which really isn't a whole lot, doing brief bursts of interval training, that sort of thing. But I talk to people, my patients about that. So exercise is certainly a component of protecting one's physical energy, and then of course diet is really important as well. And talk to patients a lot about diet. People are very interested in supplements, and I'm not a huge promoter of supplements. There may be some that are beneficial, but I really am a promoter of a healthy diet. Did you want me to talk more about that, or?
Sure. Yeah, absolutely. Yeah. Let's do that, and then I want to circle back and talk a little bit more about some of the energy drains. But while we're on the topic of, first let me ask you about exercise. So does my yoga class count as moderate exercise?
It probably does. It depends on how. It depends really on how intense it is in terms of movement and cardiovascular. If you're sweating, moderate exercise is you're supposed to elevate your heart rate up to like 60 to 75% of what your theoretical maximum is. So, I'm not sure if all yoga classes do that. They may not. Walking may be more. If you're doing your yoga, you may need to also do 20, 30 minutes of walking. But certainly, yoga is beneficial in lots of other respects. Some yoga classes may be more vigorous. I don't know. You can tell me. I've done probably a handful of yoga classes, but walking,
I think your cardiovascular guidance is good. I think that if I think about it, some of the yoga classes I take are probably more helpful for my emotional well-being than they are about getting my heart going. But so talk to me about diet a little bit. If someone came to you and said, "Hey, I'm going on this great vegan diet," and what would you say? How do you counsel people around diet?
Well, so a healthy diet, is probably a diet that has limited animal products, or certainly higher fat animal products, and so you limited amounts of red meat and other types of like fat from animals, like the skin from poultry, and but eating fish is not part of a vegan diet, but it's known that that's quite healthy, and it may be difficult to actually get adequate protein sources from vegetables. People can do it, but it requires a lot more work, and some people aren't as conscious about maintaining adequate protein intake when they have a vegan diet. So it's recommended that people eat fatty fish 2 days a week, and there's a variety of fatty fish. Many people don't do that, but tuna and salmon and mackerel and Arctic char and I'm sure there are other ones as well that I can't remember, but fatty fish, and that's not vegan, but it's certainly good for you. But in terms of, so I recommend that people try to reduce, for example, someone comes in and he or she has a cholesterol problem then, or has heart disease in the family, then certainly trying to reduce animal products is good. And then there are a lot of people, it's incredibly common to see people who have pre-diabetes and elevated blood sugar levels in our country, and we just probably eat way too many simple carbohydrates and in the form of snacks. And so I do often recommend that people try to reduce their carbohydrate intake and substitute in healthier carbohydrates, things like brown rice or like quinoa or like really grainy bread with seeds, things that are more difficult for the body to digest, that don't turn to sugar right away. And I'm a big proponent of nuts and cooking your own food. I think that's another part that is very difficult to control one's diet if you're going to eat out once a day. I mean, it's difficult. So trying to reduce the numbers of meals that you go out for, and then preparing your own food from fresh ingredients, I think is really important. And all of that ties into to weight and that, which is a component of energy too. People we have a high rate of obesity in our country, and that is an energy drain. You have to carry around if you look at cardiometabolic parameters like oxygen uptake, or what they call the VO2. If your weight goes up, that automatically really increases your oxygen consumption. So, trying to maintain, I think, a healthy body mass index is important to physical energy as well. So
that makes a lot of sense. So you're a big fan of nuts as snacks and whole grains and all of that. You're probably not a big fan of sugary sodas.
Oh, sure. No. Yeah.
So I'm curious. I also know that you are a parent, and so I'm curious as to do you have, as your kids have been growing up, have you limited the sugar intake that they've had access to?
Well, I don't buy soda and keep it in my house. I don't buy like a lot of snack food. In fact, my kids complain because I don't have enough snack food. All I have is like yogurt or pieces of fruit, and they would much rather have some sort of a Doritos or Cheetos or crackers or cheese roll-ups or fruit roll-ups or these sort of prepared snacks that are easier. But I tend to buy more fresh foods for them. Now, I don't prohibit them. Like if they go with friends, I allow them to have a soda, or I allow them to have that kind of food. I don't really restrict it, because I think as a parent, you have to be careful. Your kids will go seeking it out if you're overly restrictive with it. So I just don't get it in the grocery store myself.
Sure. That makes a lot of sense. So talk to me a little bit. I mean, I think these are some of the fundamentals that we all probably know we should be doing: getting more exercise, eating healthier. And I think for the most part, we know, most of us know what kinds of things we should be eating that are healthier. And yet sometimes we don't do it. And so that willpower to get into those healthy habits is important. Do you have any thoughts for people about how to build healthy habits?
Well, I mean, I think making kind of small steps is always a good, small steps of behavioral change where you incorporate, say if you, recognize that you're eating lunch out 5 days a week, well then, can you pack your lunch a couple of days a week to begin with? If people make small changes, they're more likely to be, if they make set goals that are small, they're more likely to be successful with those goals, and then they have more confidence that they can, add more and do more that's beneficial. So oftentimes when I talk to people, I ask them what small changes they feel, pretty confident about making, and we might set a small goal, and then I might follow up with a patient on that particular small goal, and often those goals can build into larger goals. But to take a person who's doing no exercise and to get them to start exercising 30 minutes a day is pretty difficult. But if you can get that person to walk 20 minutes a day, or to get a pedometer and to monitor steps, that sort of thing, it those kinds of small changes can be really helpful. And then I see people more often to kind of follow up on these sorts of changes. If you see a patient just once a year who has a lot of health goals, health-related challenges, then it's really difficult to make progress. So I tend to see people more often when we're working on ways to improve physical health, these lifestyle changes.
I see.
Yeah.
I've recently started wearing a fitness bracelet so that I can track my own steps. It's my version of a pedometer, and it also tracks my sleep. And I am really struck by how often I see a correlation between how much sleep I get and how much energy I have the next day. Can you talk a little bit about insomnia and sleeping well, and any guidance you have for people on, sort of what the risks are of not getting enough sleep and how to get better sleep?
Yeah, well, sleep is, I think, incredibly important. I think, I think though that people do get stressed over sleep, and then that contributes to this sort of worsening cycle of insomnia. But most, the sort of the scientific evidence would suggest that people do best when they get 7 to 7.5 hours of sleep, sometimes 8 hours of sleep per day. People who sleep more than that actually do worse, and people who sleep less than 7 hours also do worse. And there are physical conditions that are related to lack of sleep, like obesity. It seems to affect cortisol, and that seems to, people who don't sleep enough have a tougher time losing weight. And also it contributes to blood pressure elevation and diabetes. So we know that people who have things like sleep apnea have higher risk of diabetes, like independent of their weight. It's just there's something with regard to cortisol that increases diabetes risk. So, but there's been other studies showing that maybe we're too obsessed with 7 to 8 hours all at once, and that, it's okay if you sleep 5 hours and you do what they do in Spain, which is, you take a 2-hour siesta, and that probably is okay. But I think people need to protect sleep and then need to, and I think one thing that you and I have talked about before is when people need to have a consistent schedule with sleep. It's very difficult if your schedule is constantly changing to go to bed at a particular time. So if you're, routinely sleeping in till 9 or 10 o'clock on the weekend and then trying to get to bed by 10 on Sunday night, it's next to impossible. And so I think kind of maintaining that consistent schedule is important. And then, I also see people who, for example, people who've worked their whole lives and then retire, and they start sleeping in and then still want to go to bed at 10 or 11 and find that, they can't, and that upsets them, and they can't, so just making sure that people recognize that you probably won't fall asleep if there haven't been like 16 hours between when you woke up and when you were trying to go to bed. So sleep is, I think, very important for energy and for physical health, and also for psychological health. I mean, people, when you're tired, you are irritable and don't feel good. So
yep.
Right. So So that is an
that
energy
makes, that makes a lot of
drain.
sense.
Yes.
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 It is. So you talked a little bit early on about emotional well-being as well, that physical and emotional well-being are both important to resilience. What would you say around helping people support and develop their own emotional well-being? As a physician, how do you approach that with people?
Well, I think chronic stress is a big contributor to feeling bad and to poor emotional health. And I think having people recognize stress and trying to reduce stress. I see people who work too many hours, who commute, and who don't have downtime, or who are, responding to their gadgets, like, at night. I think kind of protecting, doing the things that give people outside of work that reduce stress, things that are, maintaining social connections or maintaining hobbies and maintaining spiritual connections that, give people sort of a sense of purpose, a bigger purpose is very important. So I when I see people, I ask them about stress, and I identify it and, try to brainstorm with them about how they can reduce stress. And then, I think people who have emotional needs, often it really impacts their physical well-being a lot too. And sort of, people who are, for example, depressed have more like somatic or physical type symptoms than people who are not depressed. And oftentimes treating like the depression will help with all those somatic symptoms. They make them, everyone who's 50 feels aches and pains, but if you're depressed, you might feel them a lot more than if you're not depressed. So paying attention to both physical and emotional health, I think, is very important. You can't treat one without the other.
Have you seen much in the way of people who have chronic pain in your practice, whether it's fibromyalgia or some of the other kinds of things that lead people to be hurting all the time?
Yeah, well, pain is a big and is a huge issue. There are many people with chronic pain, and it's a huge, drain of energy and vitality. I think it not only the pain, which when people are in chronic pain they get depressed, but then the treatment for the pain often and the medications to treat pain have side effects. So then often you see people who are on like 4 or 5 different medicines. Many of them are, would be sedating it to try to get rid of the pain, and that reduces energy too. So I think, I think chronic pain is something that has a very negative effect on resilience and energy and vitality. And it's a difficult problem because the treatments for it are, many of them are suboptimal. I actually like, using some of the non-traditional treatments better, things like physical therapy or acupuncture or massage therapy or exercise, stretching, Pilates, yoga, those types of things where they don't totally eliminate pain, but at least they're not creating side effects, through medications that cause negative side effects. So
that makes sense to me. I know I've been able to relieve some lower back pain through core work, Pilates, and like that, based on your recommendation, actually. So thank you for that. So it's nice to hear that there are some things other than medication that people can try. And if I were to sum up what I've heard so far, it sounds like breaking the cycle of pain is one of the most important things to help people build their resilience, that if there is a chronic pain issue going on, that's particularly debilitating. And then working with that, and then working on helping people get good sleep, working on helping people eat well, get plenty of exercise, and then take care of their own emotional well-being through good social support and doing things that are pleasing and eliminating sources of stress. What am I missing? Are there any other big building blocks of physical energy that you'd like to make sure we talk about?
Well, one thing that I is sort of thinking about with, patients who've got people who have chronic illnesses, which, if you live long enough, you'll get a chronic illness. Everyone pretty much does. But one thing that I see a lot that I think has a negative impact is what we call polypharmacy, which basically means, a person is taking too many medications. And this happens quite a bit to people as they get older. They just accumulate, medicines, and that can have a negative impact. So I think it's important for people to look at their medication list, especially as they get older, or people who have multiple health issues, and kind of review, do I really need this medicine? How much is it benefiting me? And what is, what do I really need it? And then making sure that medications don't interact, and understanding side effects from medicines, because I very frequently treat people for side effects caused by medicines that they take. And there are, medicine is good. I'm a doctor. I prescribe medicine. There are definitely medicines that are needed, but oftentimes they get layered on and never taken off. So I see that kind of as being an important part of my job, and I think people can be aware of it. And that goes for supplements also. I a lot of times I'll see people who have symptoms and they're taking 15, natural supplements, and often I have no idea what the supplements do because they're not well studied, and so it can make it very difficult to tease out what potentially could be, putting these substances in your body, and there isn't a whole lot of medical information about what they do. It can make it difficult to kind of tease out, what is causing what. So I'm a bit of a minimalist in that regard. Not that I don't like medicine, but I do feel that people need to be reasonably skeptical about taking things.
Makes a lot of sense. So talk to me about how you apply this in your own life. What are the most important things you do to maintain your own well-being, physical, emotional, et cetera?
Well, I have, I guess sleep is one, and I've gone through periods where I don't sleep well, but maintaining a routine with respect to sleep, and then, protecting it, like making sure that that if I'm overtired, I'm not staying up till 2 o'clock in the morning watching a movie or something like that on the weekend. So sleep, and then I'm a fanatic exerciser, so I do that, and that helps me in terms of stress, and it helps me, I think, with my physical health. And I try to cross-train as I get older because I can't run as many days a week as I used to without having various joint problems. And then in terms of stress, I make time to, like, one thing that I've been doing that I've enjoyed, which is also exercise, is that I go for a walk with my husband after dinner, just like a 20-minute walk. But that's kind of a good stress relief for me. And then socializing with friends and listening to music. I often turn on music as soon as I get in my house, and that's a stress relief. And then the other part is, and I encourage people to do this, but I take time off, and I think in the U.S., we don't take a lot of time off, but I take time off and I disconnect, and I try not to be attentive to all my devices as much as I normally am. And I think that's, taking time off is important. So those are some of the things I do. And then I cook. I cook during my own personal practices. I cook most days of the week, and I cook a little bit on the weekend for the week. And then I tend to go out, on the weekend a couple of times, like Friday and Saturday night.
Mm-hmm.
But I try to control what I eat through, I guess, making my own food, and I pack my lunch at work. So those are some of the practices that I do to maintain my health.
It sounds like you do a good job of practicing what you preach, and that's much to be sought in a physician, I believe. Well, I thank you very much for your time today. Believe it or not, we are at the end of our time.
Yeah,
and this has gone very quickly. I think you have hit a lot of the really important points, and I've got some ideas of how I can take some of your advice better going forward. And I look forward to hearing from any of our listeners who have additional questions around this. We could potentially do another show with any questions that come up. So thank you again. And for those of you who are listening, thank you for being here. And please join us again next week when we will be speaking with a woman who uses writing to help people heal from trauma, which I'm very excited about as well. So we'll see you again next week on Resilience Radio.